something. I just don't know if it's much.
Okay.
So
All right.
I'll get the blood, and then we'll be in touch tomorrow.
Okay.
I'll just plan on coming up and check them both tomorrow. That way, if Buddy's not any better, then we can see if there are any other tricks up my sleeve.
Okay. So at this point, I'll call Leo and let him know what you've told me and that you're coming back tomorrow to recheck him.
Yeah, I'm gonna recheck you, but I'll check.
All right.
Thanks.
You bet. I'll talk to you later, David. Bye.
Bye.
That was David Ramey, our horse vet, who was over to look at one of the horses over at Trails Inn, Buddy, who's got some chronic arthritis, and they just changed the meds on him, and he's not eating today, and he can't really find a good reason for it. So he's running some blood work, gave him a shot of Banamine, which is just an anti-inflammatory, and he's going to come back and check him tomorrow.
Hi, I'm Dr. Dave Ramey. I'm a veterinarian whose practice is limited to the care and treatment of horses. I've been working on horses in Los Angeles since 1984, and a few years ago I got a call from Leo asking me if I would help him take care of the 30 or so horses that he takes care of here at Delta Rescue. We have worked just very diligently with a great staff to make sure that the horses are treated appropriately but not over-treated. They have the great ability just to be free and cared for. We monitor their weight regularly, and anytime something comes up, I get to come up and take a look at them. It's really kind of an idyllic situation for everybody, for the horses who just get to live a good, comfortable, well cared for life, for the people that get to spend time with them, the workers who spend most of their time just hanging out with them, and they're in a great situation. And when something does happen, Leo is right on it, and the horses get the best care that's available. Okay, so we have many things to do. So you get him. Trae afuera, por favor. So Buddy is a 20-something-year-old horse that is having some issues with his kidneys, possibly as a result of some medication that he needs. And so we are going to basically try to rinse out his kidneys a little bit, see if we can get some fluids, get him feeling better and getting him eating. Because the problem that we have, the reason they call me, is that he's just not eating normally. And horses eat like horses, which is why they came up with the phrase. But he can be a little bit difficult sometimes. But he's a horse and he doesn't know we're trying to help him. So he's going to get fluids two ways. He's going to get fluids in his vein, and he's also going to get fluids orally. And because it's going into his vein, I want to make sure that I want to do the best I can to not contaminate anything. So I'm clipping all this hair away, and we'll give it a good scrub. This is just a little disinfectant scrub here. Wipe that off. And the first thing, because he doesn't love medication, the first thing we're going to do is sedate him to make him a little compliant with the whole procedure. Oh, you're all right, bud. Yeah, it's a good boy. So in a minute or so, he's going to get sleepy. Orlando, do you have any electrolytes? Salt?
Yes.
Can you get it? You can see how his head's down. He's much sleepier now. Sí, no hay polvo?
No, no sal.
Okay, well then. That's good. Here you go. There you go. So that's just a paste of some salts that we're just dissolving in the water. And then you've heard the old phrase, you can lead a horse to water, but you can't make him drink. Well, I can. So. We do this by passing a tube through his nose down into his stomach. You can't do it through the mouth because they'll just chew on it. And sometimes they don't like this very much, so we'll have to be a little careful to see how he does. Go, buddy. It's all right. It's all right. Good boy. There we go. Okay, detén el tubo ahí. So Orlando's holding the tube so it doesn't come out. It's down, it's just right, it's right at the entrance to his stomach. So it goes through the common passage in the back of the mouth where the esophagus and the windpipe meet. And then when I pass the tube back in there, I can feel him swallow. And then when he swallows, I time it and just push the tube. So the next thing we're going to do is give him 6 liters of fluids intravenously. So what I'm doing here is finding the jugular vein. It's funny, on TV, in movies and stuff, you see people injecting air into catheters and killing people that way. And I don't know how much of a problem that really is, but I do know in horses it's not a problem at all. So it's no problem to leave the catheter like that for a second. Well, we hitch this all up. You hold that, Orlando. So now this is going into his vein. Stop. Now we're going to open the fluid, and when you hold it up, you can see the liquid going into the horse. So to secure that, we're just going to take a little bit of tape, because if he jumps, we don't want him to pull the catheter out. There we go. And this is just securing the line at another spot. That's open. That's going. Perfect. So now, all I have to do is throw stuff away, and we have to wait for the fluids to go in. So we'll be here for a little bit, and nothing really is going to happen during that time other than Orlando's arm is going to get tired. Okay. So while we're doing this, I'm going to call Leo and just let him know what's going on. Hi, Leo. I'm here with Orlando, and we're running intravenous fluids to Buddy right now. I gave him about 2 gallons of oral fluids, water with some electrolyte paste that you had in it. And then we're going to run a couple of, the total of 6 liters into him IV. And between all of that, hopefully we can get the fluids and get him peeing and feeling better. I gave Orlando a little case to get a urine sample to send into the lab. I also gave him some medication to help protect his stomach, because when their kidneys start bothering him, their stomach starts bothering him sometimes too. So we'll get this in him and then give him a couple of days, and then we'll check him again on Thursday. In the meantime, anything he wants to eat is fine. And with the weather, we should have some grass if it's possible to either cut some for him or take him somewhere to get some. That'd be a good thing to help stimulate his appetite too. No, it's not. What's going on with him is his kidneys are showing some signs of having some distress. It's not a common problem, but and it's pretty early on. So I'm hopeful that we can, get this flushed out and get him turned around and feeling better. And we should be able to know within a few days. Yeah, I'll be back on Thursday to look at him. We'll draw another blood sample on him just to have to compare it to the one we did the other day. And also get some more medicine. I gave Orlando enough for today and tomorrow, but we'll get some more stomach medicine for him too. So, everything's gone very smoothly. We just have a more serious problem as opposed to a less serious problem, but not necessarily one that's insurmountable. So there you go. Yep. Yeah, we'll stay in touch. All right. Thanks, Leo. Bye. Okay, so now it's just a matter of letting time pass while the fluids go in. We don't want to run this in too fast. You can put it in so fast that it starts to go into their lungs, and so we don't want to pump it to him. We're just going to gravity feed it to him, and that way he'll be able to assimilate it a little more easily. Orlando, if you want, I can stay with him if you want to move feed bags, because we don't want that to get wet either.
Oh.
Yeah, so I'll stay here while you move that. Sound like a plan? Yeah. So we're going to use our time productively here. Since all of the hard work is already done, now we just have to wait for the fluids. He'll wake up in another 15 or 20 minutes. I'll start waking up, but since the Teflon tube is in his vein, none of this is going to cause him any distress or discomfort, so it should be easy to change the bag, and then we'll be on our way. Good boy, just stay there, you're fine. We're just getting it a little higher because as it runs out, the gravity feed starts to slow down. You can see too that his head's starting to come up a little bit. He was really hanging his head down low, and the drug's just very slowly starting to wear off now, so his head's kind of coming up a little. He's starting to look around a little bit. But we've already got all the hard stuff done, so the rest should be a breeze. I'm going to go see Fermin.
Okay, Dr. Demi. Thank you for coming.
Yep. Take care. See you later.
Thank you. See you later.
Thank you. That's it for him. I got another one to go look at. Leo emailed me and said he was eating that night, after we gave him the medicine, he started better. So this is the same paste.
Okay.
It's a different name, but it's the same thing. So let's continue with 1 tube every day. Yeah, and that's to protect his stomach, make his stomach feel better. And so if you please get a halter on him, I'm going to take another blood sample to make sure that his kidney function's getting better. So you grab him, I'll get my blood stuff.
Perfect.
Yep. These are just blood tubes to run routine blood testing, just to test the functions that were not good last time we did this a few days ago. Okay, Good boy. Well, his guts are good, so let's see what the blood says. But just 1 tube every day of the box. I know you have 28 tubes.
20 days.
Yeah, well, we'll see. We'll see. We'll go for 2 weeks and see. But we'll know more tomorrow. Thanks, man.
Thank you.
Yep. He's really done made a very quick recovery. And we'll see what the blood test shows to see the extent of it on the from a laboratory standpoint, but clinically he looks much happier than he did. So I'm very encouraged.